And good afternoon. My name is Ryan Belmar. I'm the publisher of WhatsUpNewp, and Mr. Frank Prosnich joins me. Hey, Frank.
How you doing, Ryan?
I am doing good, and we are continuing our election 2022 coverage. There's a whole lot more of our coverage up on WhatsUpNewp.com for people to read, but we are in the interview phase here as we look at just a couple weeks left before the primary.
And what a primary it is. A lot of contested elections on a statewide level, in particular, governor, the second congressional district, lieutenant governor, general treasurer. It's one that people need to pay attention to. And look at and also and this goes for I think the individual we're going to be talking to today, Luis Daniel Munoz, 37 years old, the youngest of the candidates for governor. And when you think of some of these people and they run for office, if he doesn't win, and my question is, at 37, he's got a lifetime ahead of him where he can make a difference. And so we want to talk about that as well, and why he thinks he's the guy who ought to be governor of Rhode Island.
And he joins us, and he is a doctor, as you mentioned, and you are on mute, but I can fix that for you.
Yep, there
we go. There you are.
See, it's really important. I have to say, it's really important that when you're out campaigning that you're not on mute.
Yeah, I've learned that. But thanks so much for the opportunity to share more about my candidacy. Yeah.
Well, it's good to have you here, and you're an interesting individual. You're a bright guy, and let's hear a little bit about you. And you're not a practicing physician, but you have graduated from medical school, correct?
Right. So I'm a physician. I'm a non-practicing one. I took my licensing test. The way you get a license, however, is by actually going through a certain period of residency. So then you would have the residency time period combined with the licensing test. So I know the Providence Journal wanted to make an interesting, kind of clarifying point around practicing. And for everyone just to know here, I've earned the doctoral degree, which wasn't easy. And, I did have to learn about every single disease that exists. But more importantly, than just the degree and the academics, you go through clinical training, you work with attendings and supervising residents, and you're able to really see the inequities that still exist in the healthcare system. And that's why I jumped to the industry side. And it was in the industry side for me where it was full circle, right? All of the lived experience and kind of the memories, if you will, that I had growing up in Central Falls, the inequities, the lack of help and resources for families that were struggling, including my mother, the lack of help and resources for people who were struggling with mental health and addiction challenges like my father. And for me, it was full circle, and that I was in a healthcare system that I had been drawn to try to help people. And yet consistently, I was seeing that physician hands were tied by administrators or coding challenges or any number of issues related to this for-profit healthcare system. The Office of Governor is the only office in the state of Rhode Island where healthcare, commerce, infrastructure intersect, and certainly housing, education are also there. I say that because if we lived in New York, in the state of New York, it would be different. New York City, has equivalent to its own health department. That's not Rhode Island's structure. So I'm running for the right office. I am the right candidate with the right experience, and it is the right time because we still are facing a pandemic.
So I want to go back a little bit to your. Go ahead, Ryan.
I was just going to ask a quick question and then get out of the way here. Earlier this morning, gubernatorial candidates participated in an early childhood voter forum. What's your biggest takeaway from this morning's forum?
It's interesting. I think that's top two most important issues. And I say top two because it really is the only, but racial inequities and racial justice issues, which are a part of that, are going to really be the focus of tomorrow's forum, which is the NAACP one. When we talk about children, what we're doing for children and how we're really trying to address inequities at that level, that's how we build a stronger future. It's not to leave everybody else behind, but it is important that we acknowledge in the state of Rhode Island over the last 2 decades, we've had administrations that continue to look at these challenges through a lens of privilege. And what that results in is completely underfunded child welfare services and essentially privatization of our public health system. So when I'm sitting across these other insider candidates, people who have served in office for a long time and others who have worked with administrations as corporate executives, my biggest concern is you've been there and you have not had the courage to call these issues out, because if you call it out, you have to present a solution. So today for me was all about calling it out and presenting solutions. And being 37, we don't know when our last day on this earth is going to be. So I'm going to live every day with the purpose to make it better for the next 7 generations. And that's why I'm running for governor.
I want to go back a little bit to interesting piece about your upbringing. You and your mother graduated college at the same time, correct?
Yeah, I was a few days earlier.
Yeah.
So I started earlier too. So I was the first to go to college. I stayed in college for an additional year because I worked at the National Cancer Institute. So I'd spent essentially a research year. And then that allowed me to have that kind of proximity to graduation with my mother because she got into a Feinstein program at PC for teaching. So yeah, that was an amazing experience to have.
It had to be. Um, Healthcare is that your number one issue?
You know, when you write an article, I guess people want to prioritize issues. It's actually healthcare is the indicator, right? Health outcomes are the indicator for all the other issues. So when you look at what ends up in the ER, you look at asthma rates. I'm going to say asthma because we talk about how well how good we do with healthcare and coverage for children. But we know that 4% of children that end up in the ERs with asthma attacks is self-pay. So we're really not doing well by our marginalized communities, those that are disproportionately impacted by environmental pollutants, those that are experiencing economic, disadvantages. And at this point where the cost of living is just increasing exponentially, we're pushing families into a state of despair. So healthcare is the indicator that we can work backwards to better understand housing, environment, and every other issue. But at the end of the day, what I will say, just Frank, is that it is a $4 trillion industry in this country. It is, a segment of our economy where we are spending $126 million so that private companies can manage our Department of Health, and only $65 million for the employees that we actually have as public sector workers. So our values are not really being reflected in our strategy and implementation of like how we administrate these offices. And I certainly plan to change all of that.
So there are those people who would take a look at our Department of Health or our healthcare system in Rhode Island and say it's a mess. We have the heads of both Care New England and Lifespan are on their way out. We've had a revolving door when it comes to the Department of Health, the directorship of the Department of Health. We've had a failed merger negotiations between Care New England and Lifespan after they in fact. After Governor Raimondo, in fact, scuttled the negotiations between Partners in Boston, which is Brigham and Women's now, and Care New England. We've had Lifespan gobble up Coastal Medical, which is the largest private physician practice in Rhode Island. And there's the concern about monopoly. There's a concern about leadership. How do we fix it?
Yeah, I can address facets of this, but I think the plan of fixing it isn't a 12-month strategy. It is a decades-long strategy, but we should be thinking about what not to do first. I was against the merger. I was the only candidate in this race that was very vocal about my opposition to a merger where equity was used as a marketing ploy by both Brown University and the healthcare institutions that were associated with it. And I say ploy because they were not reaching out to communities that were experiencing health inequities. They relied heavily on Rhode Island Foundation to pull some data back. And what Rhode Island Foundation did is it asked people after the decisions had already been made that they were going to move forward with it. What was clear is that Brown wanted to become a major, academic research institute and expand its cancer research and compete with Massachusetts. What's different about Rhode Island and Massachusetts when we think about an academic, medical school and certainly allowing Brown to grow is that the advantage in Massachusetts from the provider perspective is they have higher Medicaid reimbursement rates, right? And then on the research side, you have multiple medical schools competing with one another. So that kind of drives more competition in the labor force and that you have options if you're going to work there. So how do we fix things here? I will say that I believe that we should have a state-based single payer system, but to get there, we essentially need to start to rebuild our community health infrastructure, which a merger would not have done for us. A merger would have, again, probably increased the cost, but not the quality. By all studies, that's what we've seen, especially like with Yale New Haven, which is serving our westerly community. But if we build the infrastructure using ARPA dollars, comprehensive community health hubs across our 5 counties, we can address areas of need that are not being adequately addressed: mental health, addiction. I was talking to you about child welfare services and some of those areas that overlap with addressing, the health needs of children. We can also pull that in programmatically into these facilities. We should have a state-based medical school and dental school, similar to Quinnipiac University in Connecticut. So that program is a 3-year program. We can have a medical dental school. Those already exist. If we have a 3-year track tailored towards primary care that has an 80% admission rate of students that graduate from Rhode Island high schools, we can increase the number of physicians and dentists that are from here and are more likely to stay here, because Brown University doesn't accept a greater proportion of Rhode Island students. It's from out of state, and many of them, after they're done, also leave. It's not just a Medicaid reimbursement issue. It is also a where's my home issue. So we should do a better job at creating primary care providers through a fast track, and that will reduce the burden of student loans, which we know in the United States has become pretty much a mechanism for indentured servitude. So we have if we address the provider issue over the next 10 years, if we address the infrastructure around community health and make sure it's free community health systems, and take control of our purchasing and negotiations of drugs and medical supplies so that we can extend products at cost, even if we as a state are paying for it, make sure that there's no profit, bump in margins, I would say, for profit taking. If we do these things, and in the short term, yes, increase Medicaid reimbursement rates, then what we will have is a foundation of healthcare that is equipped to better support our senior citizens, those suffering from chronic diseases across all age groups, and certainly infrastructure better equipped, or that we can effectively use to address this ongoing pandemic. All of the vaccination programs that we're going to continue to have to run, given that it's COVID today, it's monkeypox, today, and then tomorrow, who knows what we're going to be facing. I said in 2018, it is important to address healthcare infrastructure. They said, why would a medical doctor run? And then we had a pandemic. Today, I have some, individuals, whether it's political pundits, or opponents, that are trying to diminish the importance of what a medical degree means in terms of providing experience, expertise, and a lens of equity that I think needs to shape Rhode Island's, infrastructure, especially around healthcare and housing and education as we move forward.
I wanted to, you mentioned community health. Sorry about the ringing in the background. But I wanted to clarify community health. I presume we're talking about places like Thunder Mist, places like Wood River Health, and those kind of community health facilities that we now have probably 8 or 9 in and around Rhode Island.
Yeah, we can learn from those models, but yes, outpatient community health infrastructure, when we, again, because, and what is the issue? The issue is also like, how are we programming that? What is our role within that infrastructure? If it's just building a building and trying to keep the lights off, then we're going to continue to face some of the challenges we face in some of our residential psychiatric facilities over the past year. We need to have an active role in programming. We need to have an active role in producing physicians and dentists, in these primary care areas that are needed today. Though the 3-year fast track can get students into these facilities, during residency and certainly after. They can qualify, depending on the area where these community health centers are, for a federal program to have their loans essentially paid off within 10 years of working. And so physicians will leave with less debt. They'll support these comprehensive, community health centers. And then importantly, beyond just the building and the lights and the providers and the reimbursement, the cost controls matter as well. The Commission on Health Insurance Rates, it is important for us to acknowledge that there's a lot of corporate interest in the administrations, whether it's coming from previous governor administrations, this governor, or even the people that they place on these commissions. We should be applying the expertise on those commissions, not to negotiate with the people that they were working for, but really to negotiate with the pharmaceutical and medical supply manufacturers so that we can capture rebates. The biggest game in healthcare is that every other cost goes on top of the foundational cost. And at the foundation of healthcare, it is expensive medical supplies and pharmaceuticals. So if we're negotiating those deals, then we would capture what middle companies tend to capture these days, which are called rebates, except there is no legal mandate in Rhode Island or in the United States to pass those rebates on. So for every $100, if the insurance company gets a $40 check back and we're paying $40 out of our pocket, then the insurance company is making money off the rebate. We need to change that dynamic, and it's not going to happen without a strong hand and an understanding of how to do this. It's interesting to me that one of my opponents that comes out of the kind of retail pharmaceutical arena or retail pharmacy arena is not presenting these innovations that we can apply around supply chain to support all Rhode Islanders, but I am.
I want to switch a little bit to the economy, and ask you your perception of where we are economically in the state, whether or not you perceive of Rhode Island entering a recession. Len Ladero, the economist at URI, calls it the philo factor, first in and last out, in terms of Rhode Island with poor economic situations. Although he says now we may not be the first in. But what the prospects are, and also to comment on Ladero has been promoting a concept for several years now in terms of having in-house due diligence. Instead of going out and hiring a consultant for every project, consultants who are often hired to come up with who know the conclusion they're supposed to find before they do the research, to have actually in-house due diligence that can respond quicker and more independently than hiring somebody when you give them their mission.
I agree with that. I mean, we can say, let's call it what it is. It's just cronyism. It's corporate donors propping up insider candidates, and you can just follow the donor rules to figure out what's going to play out. McKinsey and Deloitte were sponsoring gubernatorial candidates long before any of these failed projects were handed to them. So I would agree with that. In terms of Professor Ladaro, like he said something, he was talking about employment rates, I think recently, like maybe like a month or two ago. And he was saying that if you had just used data 2 months earlier, the numbers would have looked a lot different. And that is the problem with these statistics. It's a snapshot in time. We are in a recession. There's no doubt about that. Just anybody that's been paying attention to the stock market can see that. These kind of like swan-like events, and I'll avoid applying a color to it, though that's how it's said. What's next? What is going to tip us over the cliff? Is it after elections? Or is it something internationally that happens before? The key is, like, what do? We have $1.1 billion from the federal government. We're never going to get that type of money again. We have a federal government that really doesn't want to move on very important issues. I mean, for instance, the Individuals with Disabilities Education Act, which was, essentially came on in the 70s, has not seen more than 15% of budgetary support for programs like First Connection or programs like early intervention for children with disabilities. And so the feds are not moving. We have SCOTUS that's very conservative and threatening rights. So, like, how does this play into the social dynamics of an economy that's already producing less? And how do we kind of reverse that, or at least kind of temper it, and then start moving out of this recession? And I think it comes down to empowering people. We need to expand our Rhode Island Promise program to accept non-traditional students, people that can only attend part-time for various reasons, but that should have an opportunity to access a free community college. We should pull in our resources. So every jobs retraining program, every certification program that is even a part of a public private partnership, we should be pulling it into Rhode Island Promise. We need to streamline these programs so that as we allow more people in, we can be more essentially responsible with how we're spending and maximize the impact it has on the lives of individuals in terms of certifications. We should also be looking at creating supplemental wage programs. I've said that of this $1.1 billion, yes, absolutely, we need more for housing, affordable, low-income, subsidized housing. We need to work with municipalities to change zoning laws and to incentivize the construction of more housing in that area. We need more education infrastructure, absolutely. We need to increase the state allocation to the education funding that takes place for cities and towns. But all of that doesn't in any way remove us from the very radical step that we should be taking, which is supplemental wage programs that can get minimum wage earners towards a livable wage so that they can free up time and participate in Rhode Island Promise and in these recertification programs. We need to look at, if we're going to increase corporate taxes, as one of my opponents proposed, then we need to phase out the regressive tax, the tangible property tax, which disproportionately impacts these micro businesses. Cities and towns have to ultimately do that. But how do we use ARPA dollars to incentivize cities and towns to create tax exemptions for micro businesses so that we're not pushing all of our local businesses out, so that as we return from this recession, we have suddenly a predominance of special interests like wealthy developers that are taking over our cities and towns, like the soccer stadium in Pawtucket, which the governor has signed off on, and which I think is just completely wrong, not only for the city of Pawtucket, but in shifting, committed resources away from affordable housing and towards a soccer stadium. I mean, that is not going to get us to a state where we're building talent pools, building people up, and building local economies back up as we move out of this recession.
Ladero talks about the importance of developing skills, and that many of our businesses, what happens is we're not graduating kids with skills, and we're also not retaining them. He talks about his students often when he asks them, ready to graduate, are you going to look for a job in Rhode Island? And when they finish laughing, they talk about wages and opportunities in other states. And I also am aware that programs, I know the Johnny Cake Center in Westerly had a job training program that has not been refunded. It was funded by the state, but has not been refunded by the state, which perplexes me. Why you would not put money into that kind of program that would take some of these people who are marginal, maybe out there working, have an opportunity to improve their skills and move and be able to get better employment or better wages. I don't know if you agree with that, or do we do enough? Do we have enough skilled people? Can we keep people in state?
Yeah, so there's two things here. There's skills, and then there's having like an equitable approach in terms of how we're structuring these programs. The access points are an issue. And I think that's partly because we're not bringing everything under a single umbrella. And then if you say, okay, well, we can't bring it, or we don't want to bring it under a single umbrella, but now we have all these great small programs that we should be supporting. Well, how do we hold those programs accountable? So there was just a publication about one of the companies in the green tech space starting a kind of jobs training partnership with the state. And equity was used in the article, equity here, there. And yet I'm reading and I'm trying to figure out, well, what is the equitable approach? Like, what is the duration of the certification? How many hours a day? Where is it taking place? How are we considering the challenges of the most marginalized, which we can look at across all types of demographics, but how are we considering those? And then how are we developing access points? And then who is going to hold that program accountable? Because when you have these public-private partnerships and the state is putting in millions of dollars as a part of that job retraining program, like, how do we know it's done through a lens of equity? And then ultimately, what are the repercussions for a company not doing that? So I think we need to take more ownership. Rhode Island has been a state that for far too long dishes out millions of dollars to everyone except Rhode Islanders. And we can see it in every single system we have. An example would even be our healthcare system with managed care organizations and how much money they siphon off of public dollars that never get to actually helping patients. So we need to change that dynamic. Skills, I get from an economist standpoint, like that is an important thing, but like what skills, access to those training courses, and then ultimately is it access for the most marginalized in the state? Like that is what's important. And I frankly think that more people will fall into a category of what would be considered marginalized. There are people that are not yet experiencing poverty, but when we walk deeper into this recession and we continue to see these corporations lay off thousands of people and production goes low, and the accessories that go along with those products also reduce in terms of their provision. And then we have the multiplier effect that reduces down because people aren't eating in the local restaurants. When we see that cascade of events, there are people that are going to be on the food lines that weren't there before. There are people that are going to, be looking for ways of coming back from that crisis. And it shouldn't be just for the well-connected. It shouldn't be that you have to drive to Quonset for everything. And unfortunately, I feel like a lot of the jobs retraining programs and discussions, even around green tech, they seem to be so geographically focused that it tells me, at least, that there is not as much thought being put into who's able to get there and then who should have access, given a history of, again, lack of access.
So I don't want to go into more issues because we don't have time for that, but I want you to tell people where they can, on your website, you have a lot of information about some of your programs and what you believe in. What's your website?
Yeah, so it's governor2022.com. That'll get you to the primary website. It'll bring you right to a page where you can see announcement video, profile article, and all of my policy position papers within this cycle that have been published across various media outlets. And then also there's a link to a documentary which we released entitled Catalyst, that it's an hour and a half. Over 25 community organizers and activists who have been fighting the fight for years came together to show and talk about what they've been fighting. And just a trigger warning that there are incidents like the smoke shop raid in the early 2000s that come up, because we need to show how previous governors and administrations have abused and committed injustices against communities that we continue to advocate for today. And I just want to say, in terms of about my background, it's no surprise, Frank, that for the second time in a row, running this race, this time very different, with national endorsements, with all this stuff, I am excluded only from one debate. I'm on Channel 10's debate. I've been in every single forum. I'll be in the NAACP forum tomorrow. Only Channel 12. It is the same channel that removes my doctoral degree from my name. It is the same channel that refers to us as minority leaders instead of leaders of color at a minimum, or just leader. So it's important for me to just tell the audience, however uncomfortable, that there's a level of codedness in Rhode Island politics that tells the working and the marginalized and the working poor and everyone else that's not the insider, part of the insider group, you should not run. And if you do, we will discredit you. So I am, again, going to fight through all of that. And the reason that we need to do that in the campaign is it's not going to be any easier when I'm governor. Right? It's not going to be any easier. So the fight has already started. Anyone who has that fight in them and wants to support, please reach out, whether it's a yard sign or donation, everything counts. We're not leaving, and we will be on the debate stages that do allow us. And from my perspective, it is the most important time in the last 30 years to run, because the governor will have $1.1 billion to help negotiate with cities and towns to do what is right.
So I have a couple of quick questions. Financially, you're going to be outspent by basically thousands of times over. How do you combat that?
So you either play by the game or you don't. So we have all these candidates that have raised money, and that money has a price. And who's going to pay it? It's going to be Rhode Islanders. We had one candidate who's operating in the game and then goes and sets a red box on their campaign website, and they just happen to be in a very important position currently in elected office. And then what is the logic? Well, this is the game. We need money, so we'll be unethical. So that's fine. I may be the most outspent, but for anyone that wants to take a look at the forums, I continue to be the one that's vested in communities, continue to be the one that's working alongside community leaders that have been doing the work for years, and also with programmatic solutions that need to take place. But none of that really matters. All of that is just pandering if I don't have the courage to push back against a system that has kept us out. So everyone else could pander, but what I know is this: they've sat in those offices, or they've worked with offices, whether it's one of my opponents that worked with 38 studios, or it's another one of my opponents that sat by while minority and women-owned business contract requirements in 2020 were waived and said nothing, or another one of my opponents that suddenly is now progressive, but if you look at the history, was fine with taking money from people that weren't. So there's a lot of hypocrisy in politics, and I'm just trying to be the realist, the most straightforward, and the most transparent, because that's what it's going to take to change Rhode Island for the better.
So two more questions. And I take all of that, and everybody talks about the policies. To me, the most important issue is leadership and the ability to serve as a leader and to get people to follow you. What makes you think that you can provide that leadership for the state of Rhode Island? Yeah,
friendship and diplomacy are two different things. And I think it's reasonable to be, it's important to be respectful, but it's also important to lean on legislators and municipal leaders that ultimately don't want to move because they have, for instance, another plan in mind. I don't see why we should not be moving on low income and affordable housing across all the cities and towns. Now, Portsmouth may only have 2.7% of that, but I know that Portsmouth does want more money for its education system, whether it's transportation or infrastructure. So can we negotiate with cities and towns to do the right thing, and everybody wins? I don't think that the backroom closed door deals is how we should move forward. So from my perspective, the governor's office is one of activism. It is an educational platform to inform voters of the issues and to provide them with solutions that they can continue to advocate for when I'm long gone from that office. And the role of a leader, in my perspective, is one that works to make themselves obsolete. You know, we have a short period of time to set ourselves on a course to get out of this recession quickly. And I believe that there are many legislators and local leaders that are prepared to do that, but we need a catalyst. And I'm running for governor because that office is the catalyst.
So my last question, you may not want to answer it, is if you don't win this election, what are you going to do? You have a lot to give. You're bright, you're articulate, you have strong positions. How are you going to remain active and work for the people?
It's all about the people. Just as much as I've remained active. And again, please, everybody, take a look at Catalyst so you can see a lot of the work and organizing that we've been collectively doing throughout the state. This is not a short-term fight. And so the hypothetical of win or lose, you know, we have to operate under the assumption that we must win. And that's the spirit that I'm moving forward with.
Luis, thank you much.
Thank you.
This morning or this afternoon? This is afternoon, right?
It's afternoon there, Frank.
Afternoon. Yeah.
It's morning somewhere. It's morning somewhere.
Yeah, it is morning somewhere.
One more time, your website?
Yeah, www.governor2022.com.
Nice job grabbing that domain name.
Yeah.
I was using your full name, which I guess a lot of people could miss a letter or add a letter.
Yeah,
so
exactly. Governor 2022 is simple. Yeah.
Well, good luck, and you know, just for one, if you're not elected governor, I hope that you don't fade away because you have a lot that I think it can offer the community.
I won't, but there are positions we need to fight for, right? You know, there's a history of tokenization in the state, and unfortunately, it puts a face to a program, but the leadership behind it continues to operate the same, and I can't accept that. We can't accept that. So, thank you.
Excellent. Well, thank you very much.
Thank you.
All right. And Frank, that is another. Well, first, let me mention that if anybody missed any portion of this, they can watch it on WhatsUpNewp.com. You can share it with your friends, other voters, family.
Share with people who aren't your friends.
Yes, share with your enemies. And you can find all of our interviews as well as stories about the candidates and our election 2022 ongoing column. And all of that available right there on WhatsUpNewp.com.
What's interesting, just real quickly, about these gubernatorial candidates is there are vast differences between who these people are, what they represent, and often their approach to the different issues are not so different, but their approach to how they operate in office could be very different. So watch these; they help you learn and make decisions.
And just our disclaimer once more, because we didn't say that at the beginning, we have invited all Democratic gubernatorial candidates to join us. Last week, we chatted with Helena Folks, and obviously we had one today. And then on Monday at 3 p.m., we'll have Secretary of State Nellie Gorbea, who's running for the governor's office. We will continue to book them. Follow along with our newsletter available on WhatsUpNewp.com to find out when the next one will be scheduled, to find the videos and all of that good stuff.
And we'll try to keep up with all the other news that comes down from the election as well. But pay attention, be a smart voter.
September 13th is the primary. It is a Tuesday, and get out there and vote, and we'll keep you informed. All right, Mr. Prosnitz.
Very good. Thank you, Ryan.
Thank you. On behalf of Frank Prosnitz and all of us here at What's Up Noop, I want to thank the doctor for joining us. For more information or to watch this video again, visit whatsupnoop.com.